Thank you all for being here. And before I get into my questions, I just want to briefly talk about the postponement of the EHRM project. And I think we've all had those conversations on how we anticipated that this was happening. And I think from an oversight point of view, you take a serious risk in terms of being okay with postponing. So I just hope that we continue to have a transparent update, especially as the health information exchange goes live. I'd like to have an update at that point, as well as on June 5th when you have
Yes.
your
Yes, ma'am.
mandate, your assessment date on that. And then finally, just highlighting that giving your practitioners the power to come to you and the freedom to be able to say, we're not ready. Also, again, understanding there's certain balance as well of at some point you just have to sort of rip the Band-Aid off and move and with what you have. So understanding that ultimately veterans care is important, making sure we're just in constant conversation about that and understanding what's going on would be greatly appreciated. I want to talk about the VA infrastructure modernization. It's a department-wide investment. Each administration and office in the VA has to play the same role in assessing the needs and whether some level of contribution is required. For instance, in the case of funding infrastructure for EHRM, the maintenance and regular refresh of that infrastructure and related physical infrastructure investments, OHERM, OIT, and VHA have a responsibility. However, there's little to no transparency in the budget that was submitted that clearly lays out how much of an investment is expected to be made and where the money's coming from. And without that transparency, there's no way to assess that the $1.2 billion OEHRM investment in infrastructure is going to get us where we need to be. So the question is, at least in the case of EHRM, did OEHRM, VHA, and OIT sit down and hammer out the infrastructure investments, including refreshing that infrastructure during the implementation period and non-recurring maintenance, and come up with a number and a plan?
And I can answer that. And the answer is yes, they did. In fact, we made a transition from the infrastructure piece being partially funded by IT and partially funded for EHRM, putting it all in EHRM. They have teams doing infrastructure assessments, and the modeling is the costs are based upon those models. So, and we can actually walk the budget numbers much more granular to actually to specific sites.
Great. I would just like to see the number and the plan.
Yes, ma'am.
I want to go on and talk about the budget includes the $1.18 billion for infrastructure readiness for EHRM, additionally $1.85 billion in non-recurring maintenance. How much of that $1.18 billion infrastructure improvement would be needed, is needed outside of EHRM to fully modernize VA's infrastructure? Just really put it more simply, if there wasn't the EHRM project, how much of this would be needed to bring the VA to an acceptable level of technology?
Yeah, I can answer that as well, and I would say all of it, and that is infrastructure, as I think as the Secretary mentioned, to upgrade communication closets. And when you see some of them, you'd be truly shocked. And in fact, there was one anecdote that after the upgrade, I think it was at Spokane, the infrastructure upgrade with the technology, they were able to change login times from something like 30 minutes to like 15 seconds. I mean, it's that significant.
Okay, great. Just one final thing on the VA's ITOP EHRM alignment. The department plans a full transition to eradicate the cumulative technical debt in 4 years, which I completely appreciate. Based on this alignment plan, a significant number of systems, especially the endpoints upgraded in 2021, would be scheduled for replacement in 2025. Looking forward, will OIT be absorbing the cost of future updates, upgrades, refreshes of technology that was originally funded through OEHRM or VHI?
So we're looking actually at a different model where we shift to sustainment of certain things being borne by the user. We have a working capital fund. So I guess if we could take that as a TBD, we're looking at various models of how to fund sustainment and then the refresh going forward. As it sits today, OIT would, but I'm not sure that that'll be the case going forward.
Okay,
Yeah,
great.
thank you. Mhm.
All right, thank you very much.